You get to your doctor's appointment perfectly on time, and the receptionist tells you to have a seat, the doctor will be right with you. So you take a seat, and you sit, and you wait. You look at your watch as your appointment time comes and goes. You're still waiting. Sound familiar? Have you ever stopped to think why the doctor might be running late? Maybe a patient just passed away and they need a moment to compose themselves. Maybe a family member had an emergency. Have you ever stopped to think that doctors are also just people with families and friends and things that they worry about outside of the office? This is my family tree. My brother is a radiologist, my father's a surgeon, and my mother ran his practice until they retired. My grandfather was also a radiologist and my grandmother a nurse, and my other grandfather was the superintendent of a hospital and a general practitioner. I have many aunts, uncles, and cousins who are doctors, nurses, pharmacists, and anything else you can imagine in between. Then there's me. I'm a designer. I grew up surrounded by medical professionals. I saw firsthand the toll that it takes on them, both emotionally and physically. Back in June, I went for a CT scan, and the radiologist found something incidental as well. Something that he wasn't asked to look at, but that he found anyway, because it's his job to look at the whole picture. They found nodules in my thyroid. After a sonar to confirm, it's been determined that 3 of those nodules are suspicious enough that tomorrow I'm getting surgery to completely remove my thyroid. Why am I sharing my personal medical history with you? Because this is the perfect example of a radiologist having the time to uninterruptedly focus on a scan and look at it holistically. Time to let you in on a secret. I'm not just a designer. I'm a healthcare solutions designer with a PhD in information design. I took the long way around, but turns out I'm in the family business after all. In my research, I found that 2 of the biggest things that frustrate doctors are not feeling respected and not having time to focus. So, through an empathic, human-centered approach, I created solutions to help alleviate some of those problems. I'd like to introduce you to Sia. Sia is a composite character of the different radiologists and registrars that I interviewed through the course of my research. She is 30 years old, she's a mother, she's married, and her kids love it when she reads bedtime stories to them in different voices. She's a 4th-year radiology registrar, meaning that she's a registered medical doctor busy specializing in radiology. She works at a public teaching hospital with 8 other colleagues ranging from 1st to 5th year. She works full-time, she looks after her family, and she still has academic obligations as well, such as exams and presentations. In short, she's incredibly busy. Through my research, I uncovered 3 themes, which we'll be looking at today, that I helped to form solutions around. The first being frustrations from distractions and interruptions. Remember Sia? Her biggest annoyances are the landline telephone in the department ringing, as well as doctors walking in and asking her questions while she's sitting at her desk. She wishes she could lock the door and smash the phone against the wall. That's how much it annoys her. She once counted 13 interruptions in the space of 30 minutes. That's 1 interruption every 2 minutes. Interruptions break her train of thought and make her worry that she might be missing incidental findings, things like my thyroid nodules. According to one study, even just 1 phone call in the hour leading up to a report being written can cause registrars to make 12% more mistakes. Which leads into our second theme. A lot of radiologists feel that they're not respected or understood within their field. Sia feels that other doctors often feel that they have the right to come in and just disrupt their daily workings. She equates it to walking into an operating room while the surgeon is busy, grabbing him, and taking him out to the ward to go and look at your patient instead. One study found that almost 2/3 of radiologists felt underappreciated by leadership in their hospital. There's also a strong correlation between feeling underappreciated and burnout, and studies show that this is steadily rising. My own grandfather, the radiologist, cautioned his sons against specializing in radiology because of the lack of respect he felt he received at times. This brings us to our last theme, the importance of community to a radiology environment. Sia believes that community and camaraderie are incredibly important within their environment. For Christmas, they decorate the department to make it feel like home. But the big thing that binds all of them together, besides radiology, of course, is coffee. One time the CT scanner broke, and someone said, well, at least it's not the coffee machine. Why am I telling you these stories? This is a community of highly skilled, highly qualified professionals who thrive in a high-pressure environment. They're overworked, they're frustrated, and quite frankly, they're running at capacity. So the solutions that I created, the interventions, aim to help alleviate some of the frustration in this space. So we're going to follow Sia through an interaction where these solutions have already been implemented. She's busy investigating a scan when out of the corner of her eye, she notices a doctor walk past. He doesn't interrupt her, and she's grateful because she knows that due to the interventions in their space, he's not going to come up and interrupt her while she's working at her desk. She gets a notification on her cell phone, and again, she knows she can dismiss it right now. If it were really important, someone would have gotten her attention. She takes a few more minutes, does some research, and finishes up reporting on her scan. She then picks up her cell phone and notices that it's a message from Dr. Salim. As she walks over to go and meet him in the consultation room, the landline phone rings. One of the first years answers. They're a physician liaison busy with non-interpretive tasks like answering the telephone. She's grateful that she doesn't have to do that anymore as a fourth year. She meets Dr. Salim in the physician consultation room and takes him through the scan that he requested. Afterwards, as she walks back to her desk, she's grateful that the doctors no longer walk up to her while she's working, and instead she can focus when necessary. Next, we're going to look at the same interaction, but from the point of view of the visiting physician. Dr. Salim walks into the radiology department, past the registrars, who he's not interrupting, and follows the clear signage to the physician consultation room. As he gets there, he sees a tablet on the table, and as it welcomes him, he answers the 4 simple questions and submits it, knowing that they'll get back to him just now. He looks around the room and sees what can only be described as a coffee shrine. He walks up, makes himself a fancy cappuccino, and laughs at some of the coffee-related jokes around the machine. He then sees a monitor in the corner with some QR codes on it, and he sees that these QR codes are journal articles as they relate to his speciality. He scans one on MRI staging for colorectal cancer and walks over to go and sit on the comfortable couch in the corner. A few minutes later, Dr. Sia walks in and welcomes him, takes him through the scan that he requested, and as he walks away again back to his own department, he's pleasantly surprised at these new interventions that have been put in place that allow him to spend dedicated time with the registrars. He can't wait to tell his colleagues the joke about the coffee cup he just saw. These are just some of the interventions that I created as part of my research and that aim to show that empathic human-centered design has a lot of value when we look at designing solutions for the people in their space and not just for their job functions. Now, Sia can go home and spend tonight reading bedtime stories for her kids without wondering, has she forgotten an incidental finding? Instead, she can focus on which voice to use for Mr. Fox. And I can go into hospital tomorrow, grateful that my radiologist found a serious issue that I had no symptoms for. Thank you.